wanted to have some discussion, and if it's necessary, Olaf, we already prepared the breakout room for
Good.
students to discuss, and then we already chose each group to have one participant at least to share the discussion result in English. So I think it will be great for you to manage it. So please,
Perfect.
you can start the class.
Yeah, thanks everyone and good morning from my side. Very early morning because I only traveled in from Brazil. So for me, it is 5 o'clock in the morning still until I get adjusted here, 9 o'clock in the Canary Islands. And it's very nice to be here. And let's start the class. I know that, we may have some language issues and barriers since I don't speak any Indonesian language. And that means also that I'm going to rely a lot here on sort of communication in groups here. And I know we have an allocated person always to look into feeding back. So lots of group work here, if that's okay. Just give me a thumbs up that you can see my slides. I'm just going into presentation mode as we speak. Is that correct? Can you see my slides?
Yes, we can see your slide pretty clear.
Perfect. Thanks for that. I was also asking if it's possible, give me the rights in the participants to open the breakout rooms that you prepared, because then it makes it easier for everyone involved in the media. Okay, so very happy to be here in General Soedirman University with the Global Health module, and I'm very happy to have this collaboration here as well. Greetings from Heidelberg. I think perhaps some of you will have seen a few pictures already of the beautiful city. And some of you had the chance to be in Heidelberg, and I hope to see more sort of in our beautiful place. Perhaps you will have heard that Heidelberg altogether is the oldest university in Germany with the year of foundation in 1386, and people in Heidelberg are fairly proud about that, of course. These are the ugliness of the buildings of the 70s where we are. Just before we get started and talking about global health actors, start thinking, what is that global health actors? We have 1 hour 40 altogether. Start thinking because it's going to be you answering a question in a second. But first, a little bit of self-promotion for Heidelberg. If you come to Heidelberg, unfortunately, you have not only to come to the beautiful city, but also to the ugliness of the old buildings. However, at least we always try to schedule, sort of that you are also seeing this very old city. And if you're really lucky, if you want to, then you can see that in January and February, mostly with snow as well, if you wish. Now, climate change is changing everything. When I was studying in Heidelberg, we had regularly weeks and weeks of snow, and now you're only having a day or so. So you really need to schedule your travel if you want to see the city like that. Right. Greetings from our long-standing master course. You see already how international we are. This is a typical graduation for our master course in international, now soon to be labeled global health, that as a matter of fact has been running now for 35 years. So several hundreds of people did this particular course, all targeting sort of people who are going to work in the context of international collaboration somewhere on the planet for those global health actors we are just going to discuss in a second. More modern sort of graduation pictures. Yeah, as you can see, we have a lot of fun as well, and hopefully you're going to see this in Heidelberg once you come there as well. For teaching and anything research related, go to our websites, but also the teaching unit has a website with the Master of Science here, now soon to be called Global Health. Our short courses under undergraduate teaching, all the alumni networks and capacity development elements altogether. However, I'd like to underline, and this is where I stop my promotion before you stop me. You're supposed to talk about global health actors. I'd like to underline that we like to be very participatory. So from here onwards, it's going to be far more you than me, if that's all right. However, we also have lots of questions, so that's actually very good indeed. We're going to have a session of 1 hour 40, and I hope I was dot on time. And I usually finish dot on time. It's fairly late for you, I suspect. But with the time changes, we don't really have any other options. So we're going to discuss actors in global health with the agenda of concepts. What are global health actors? What does it mean? And then, of course, identifying and classifying main types, categorizing global health actors, and describing perhaps interactions and power dynamics between global health actors in the global context, of course. So I talked a lot. I think it's time for a break for me, and you start to work. I think we've got some breakout rooms. I suggest, because once you're in the breakout rooms, you're not going to see this question here any longer. Take a picture with your camera or take a note. And what I would suggest is I'm going to open the breakout rooms. You get 10 minutes, just a little bit more. I'm just going to go around and nip into the breakout rooms to see if everything is all right. But you don't need to answer when I'm there. So you're most welcome to not use English when you're discussing, much easier. Take a picture of the question you have. You allocate one person who is a timekeeper and perhaps one person who directs a bit the discussion, but have one person allocated already here for feedback in order to make sure that we can easily communicate in English. And in that context, I would suggest go into the breakout rooms, discuss what do you think? What does it mean, global health actors? You are most welcome to use the internet and see if you actually find some agencies, and perhaps you want to come up with an idea how to categorize the agency. There are different types of agencies, and we're going to explore different ways of categorization in a second. Is the question clear so far? I think it is, no?
Yeah, it's
Any
clear.
questions?
It's clear.
Yeah,
Yes, sir.
perfect. And as I said, unlike, we have a bit of a cultural barrier always here. Nadia Weiss knows already, we like to be called Olaf simply, no sir, no professor. And I know that's very
Yes.
tricky if
Yeah.
you're not used to that.
Yeah, we are
but
not.
it's very difficult, I know. But that's how we operate, but you don't feel obliged. Right, let me see if I find the breakout rooms.
You can see the breakout rooms
Let's see
below
if I
the
find
Zoom.
them. I'm actually not, I can't see them actually. I'm only seeing join breakout rooms. So I
Oh,
don't
yeah.
have the full rights. I need the rights as a co-host, if you don't
Oh,
mind.
okay. I'll assign
In
you
the
as.
list of participants, I like to time control, so that's okay.
Yeah, that's okay. That's okay. We can manage to do so.
Just make me host co-host. That would be fine.
Okay. So
Technical
we have
break for a second. Go in the list of participants. Click right on those dots and make me co-host. I think it's only who is labeled here Kesmas FIKes okay. I should be now co-host, I think. Here we go.
So you can join to all the breakout room if you wish to.
Let me see. Now I want to open the breakout rooms first. And I still don't have the rights. So can anybody who's got the rights open the breakout rooms?
I think several of them already joined the breakout
Oh
rooms.
no, they're already, somebody opened them already. I can see. Yeah, if you all go to the breakout rooms and address the question, you have 10 minutes, more or less.
Please, ladies and gentlemen, if you haven't joined your breakout room according to the group that we already shared before, you can join now, or you can ask for help to assign you to the breakout room that already been selected for you.
So hopefully you all have a notification to go to the breakout rooms. Please join your breakout room now. Thanks. and everyone. Yeah, perfect. Working. I do a quick tour around the breakout rooms.
Only several of them left. Maybe around 7 people left that has not been assigned.
I can see that, yeah, exactly. But I go around. I just want to see if they get the question and they're happy. The
Okay.
animal, I always come back. I nip in and out. It always takes a bit of time until it's connected. Huh?
Good.
All going well so far in the groups I visited. See you.
Okay, I'm done assigning all the participants into the breakout room. So I think everyone is already joined to the breakout room. Itu Olaf lagi chat.
Udah bisa muter kan ya, Olafnya?
Ya, dia lagi muter ini.
Oke, oke.
Di room.
Oke.
Screenshotnya lu kasih ke Prof Dwi. Aku gak bisa buka. Oke. Maybe I should join the
Aku
WhatsApp.
belum screenshot tadi. Apa
I did.
sih?
Okay.
Oke.
Look at this. I
Ya,
sent it. Here.
oke.
You
Record sih ini.
recording it.
Yuk.
Okay. You
Oke,
recording it.
yuk.
Been around. They're all working nicely. So we give them another. They only started now, so we give them a bit more time. I'm going to send a message around.
Okay.
Was you okay?
Yeah. It's okay.
Yeah, busy.
Caught up with some work, administration stuff combined with teaching, researching, and also community services.
Mm-hmm. But all good, all doing fine so far.
Everything doing fine. Everybody's doing
Okay.
fine. Thank goodness we managed to do so.
Is your registration in Heidelberg done already or not as yet?
Yeah, I'm still waiting for my scholarship. I think they will announce the awardee by the end of this month. And after that, once I know whether or not I got this scholarship, I will definitely
Yeah, then register.
contact the
No,
administration.
perfect.
Yeah.
Hopefully. Keeping fingers crossed.
Finger crossed. Finger crossed. Hope everything goes smoothly.
Yeah.
I've been applying this scholarship for twice now. The second one I didn't get that much luck, so hopefully this time finally
Yeah.
university
Yeah.
me.
Very often it's persistence, no?
Yeah. I told Safi about that too.
Yeah, yeah. It's always tricky because, sort of one doesn't really fancy to always apply and all of that. But if you want to do something,
True.
sometimes one needs to pursue, no? Simply see
Yeah.
what can we do in order to make it happen. Another 2-3 minutes, and I get them back.
Okay.
I think with the language barrier, that I realize that sort of it's probably best if we do it that way. So we do less content, but more discussion in the groups, I thought.
Yeah. From what I heard, they're currently enjoying the discussion. If not, they felt like, what are we gonna say to him? What are we supposed to say? What are we supposed to say?
Yeah.
So that's why we're here for. Maybe I can help
Yeah.
them even if they have any
Yeah.
difficulties despite the language.
So there were, I think you allocated already one person as a speaker in each group who is a bit more fluent in English. Understanding is probably not so much of an issue, no, but it is far more about speaking, no?
Yeah.
Yeah. Okay, I got them back now.
Yeah, several.
I'm really, I got back from Brazil 30 hours ago, so I'm a little bit
You're so jet lagged. You're so jet lagged, and it's never.
Yeah, and it was a 24-hour journey door to door. And I'm in my winter home in the Canary Islands. I'm on my way to India now on Saturday.
Oh.
So I'm a little bit.
Yeah, the time difference kind of make you, jet lag is always real, huh? Especially when you have a very long flight, time differences. I understand that must have been tired.
So I'm just going to send a message around 1 more minute.
Yeah.
And then we see whatever that produced. And I have one more.
Okay, some of them already back into the main room.
Is it? Can you hear me again?
Crystal clear, sir.
Okay, perfect. So let's see that we're going to close the rooms and get them back.
Okay. Breakout room will be closed in.
I do it always. Don't you worry.
Oh, you did.
I do
Okay.
I always do that. I'm fairly. Yeah, exactly.
Okay.
I use a lot Zoom, so.
We can tell you are more capable doing the Zoom technically than I do.
I don't believe you.
Please believe me a bit.
I don't believe you.
We've been practicing using Zoom only in COVID era. Well, now in class several times.
We do a lot because, of course, with all the international work, it saves on travel quite a bit, for smaller sessions, etc. Here we go. Hello, everyone is back. That's nice. Thank you very much. We're still waiting for a few more to come back, as I can tell. Some are still taking the opportunity to discuss, but I think we are all back now. That's perfect. Thank you very much. Let's see. Who wants to feedback first? What did you discuss? Just a brief summary, and we're going to work for those who are rapporteurs to work with saturation. So just add on what the other person perhaps had said, the other groups. Who wants to go first? First group. Who wants to go first? Volunteers to the front before you get volunteered.
Let me first, Olaf. I'm from group 4.
Perfect.
So, what are the different actors like agency, institution, etc., working in global health? Perhaps we find a way how to categorize the actors. First, global health is shaped by diverse ecosystem of actors with different mandates, powers, and resources. These actors can be grouped into 7 major categories like multilateral organization. It's funded and governed by multiple countries like WHO and World Bank Group, UNICEF, FAO, ILO. They shape global standard, priorities, and funding flows. And then second is national government, like in US, like CDC, Public Health England. They implement global guidance, regulate health sector, and contribute to the global initiative. And number 3 is bilateral development agencies. These are government-run donor agencies that fund health programs abroad, like USAID in United States and GIZ in Germany. Why they matter? Because they shape global health through diplomacy and major financial resources. And number 4 is global health initiative and public-private partnership. Examples like Global Fund to Fight AIDS, tuberculosis, and malaria. And then CETI, Coalition for Epidemic Preparedness Innovation. Why they matter? Because they mobilize large-scale funding and deliver high-impact disease-specific program. And the fifth is non-governmental organization or NGOs like Save the Children, PATH, Medicine Sans Frontiers, or MSF. Why they matter? Because they work directly with communities, often where government cannot. And then number 6 is philanthropic foundation like Bill and Melinda Gates Foundation, Rockefeller Foundation, etc. Why they matter? Because some foundation have influence comparable to the government. And the last 7 is academia and research institution like John Hopkins Bloomberg School of Public Health or London School of Hygiene and Tropical Medicine. Why they matter? Because they generate data, train professional, and introduce innovation. Thank you, Olaf.
Sorry, I was muted. Well done. That was very comprehensive already. Very good presentation as well. Thanks for that. Anything to what anyone else wants to add on or to present whatever you discussed in your group? Everybody gets a chance, or groups. Don't forget, you want to volunteer, just unmute yourself and speak up. If you don't volunteer, you will be volunteered.
Okay, so I'll go, Olaf.
Yes, please.
Okay, let me introduce myself first. My name is Razin and I'm from group 6. Okay, so you say there are different actors working in global health. So today, so I will talk about the stakeholders in global health and how different actors play a role. There are 3 main areas in global health: disease prevention, access to healthcare, and pandemic response. So we can understand the actor by looking at 3 points: their main role, their funding resources, and their operational scale. So there are a lot of actors in global health. First is governmental actors. For example, it's Kemenkes or Indonesia Ministry of Health. They have a main role to create health policies, manage national programs, and then the funding source-nya, and the funding source is from the government budget or APBD.
Suaranya Mbak Razin.
Oh ya?
Suaramu agak kedengeran.
I'm sorry. Can you hear me?
Yes, we can hear you, but I think you have been better closer to the microphone earlier. But if you want to continue.
Sorry, because I'm using, wait. Okay. Okay.
Just continue, that's fine.
Yeah, there's Yeah, okay, let me. Okay, and then the governmental actors like Kemenkes, like Indonesia Ministry of Health, they create health policies, manage national health programs, and then they have a funding source from government budget, and then the operational scale is at national level. And then the second is intergovernmental organization like WHO and UNICEF. They support many countries by giving guidelines, and the funding source is a contribution from the member countries and donors. And then the operational scale is global or regional. And then the third is
Perfect.
NGOs. Yeah, we know that NGOs, there are Red Cross, they help communities directly, and the funding source is from donation or maybe charity. And the operational scale is from local, national, and also international. Yeah, maybe that can I say different actors in global health have different responsibilities, funding, and scales of work. Thank you, Olaf.
Perfect. Well done. Well done, Razin. And for the next group who wants the feedback, perhaps anything else you said, or focusing only on anything that has not been said, or perhaps you want to just present what you were discussing in your group. We still have groups, I believe, 1, 2, 3, and 5.
Okay, Olaf. I'm from group 5.
Perfect, Arena. And
Okay.
apologies to everyone, I'm not so good with your names. No? So,
Yeah.
correct me if I'm pronouncing wrong.
Yes, right. My name is Aurina. It came from what? Aurum, Olaf.
Oh, nice.
Yes. Okay. We are from group of 5. Would like to explain about different actors working in global health. It's similar with the other groups, which we find 10 actors. Number 1, we have UNICEF, WHO, UN, CDC, USAID, World Bank, Global Fund, and also government institution like university and also Gavi, the vaccine alliances. And we make the WHO as global policy maker with UN, United Nations, and also UNICEF. And then funders like World Bank, USAID, also Global Fund, and the implementing agencies like government, the Ministries of Health in Indonesia, and then researchers like university, and then Gavi, also the global policy makers. Like that, Olaf. Thank you.
Well done. Also very good overview. And for the other groups, 1, 2, 3, do you want to feedback?
Maybe
Unless
I
you
will
say
add,
that's what the other already said. Yes, Saksikan.
yeah, I will add just differentiation between the organizations. Excuse me, wait, I'll take my notes first. The NGO between the global health, so many function in global health, like the function or the rule for the global health. The first one is about the funding agencies. The funding agencies, the task is about to provide the financial support for us, for the countries that will increase the health in the countries like Asian or maybe Europe, like World Bank, Global Fund, or Gavi. And the second, the norm setting and regulatory agencies to develop and guidelines, standard, and also global norms, like many friends said before, WHO and FAO. And the third, the implementing agencies. The task is about to conduct a field work, deliver the services like MSF, UNICEF. And the fourth, the research and evidence producers. The task is about to generate the data and scientific knowledge like IHME and the major universities like Pak Anam said before. And the last one about the advocacy groups. The task is about to promote health rights and influence policy. Like we said, the
countries has Kemenkes and also the other countries health ministries. Thank you.
Perfect. And a very good, also the idea to categorize according to the functions. We come to that in a second. We're going to discuss two ways how to categorize data. One of them is who gives you the mandate to work, and the other one is going to be historically, but we come to that in a second. So we have two more groups to present. Well done. I hope I'm pronouncing right, Saksikan, yeah? Two more groups to present.
Hello, Olaf.
Yes, please.
Yes,
Rindi, yeah?
yes. My name is Rindi from Group 1.
Perfect. Over to you, Rindi.
Okay. So we have discussed the topic, and the result is in our group, the answer is not different from previous groups. And I agree with Miss Sasi. The World Bank is considered of a global health actor because it's play major role in financing, shaping policies, and supporting health system development.
Mhm.
And the other categories like international organization, national government, NGO, it's same with others group. Thank you.
Perfect. Well done. And for the last group, I believe number 2, if I'm not mistaken, if the Germans can count or not, let's see. Okay. For the last group, any speaker?
Okay, from third group, Mr.
Oh, third group. Sorry, yeah, exactly right. Yeah. Over to
Okay.
you, Laxmita, yeah?
Okay, we discuss about different actors in global health, and the one is multilateral organization, international bodies support by multiple countries, example, WHO, UNICEF, World Bank, and UNAIDS. The role is the global coordination, guidance, and surveillance financing. And then the 2 is bilateral agencies. One country giving assistance to another, example, USAID, and then GIZ in Germany, and JICA from Japan. The role is health aid, capacity building, and development programs. And number 3 is NGO, independent groups delivering service and advocacy, example, MSF, Save the Children, and CARE. The role are humanitarian response, community programs. And the 4 is private sector or philanthropy. The companies, this is the companies, foundation, and private donors. Example, Gates Foundation, Wellcome Trust, pharma industry. The role is innovation, vaccines, technology, and funding. Number 5 is academic and research institution, like universities and research center. Example, Heidelberg Institute of Global Health, and the role are evidence, training, policy support. And then the last one is civil society and community actors. This is grassroots groups and patient networks. The role are advocacy, then accountability, and local implementation.
Well done. Excellent group work altogether, because also you started to categorize. Well done. And I like that, because there's different ways how to categorize. We're now having a few slides. So everyone, I encourage, if we're going to have slides right now, have a notepad next to you for questions, either on paper. If you're an old person like myself, then you have paper and pen. If you're modern, like you, Ola, and young, then you do it electronically. So have a piece of paper next to you, and then we're going to discuss a little. With your questions that are going to come up, take note. And we stop then for questions. So one thing I wanted to underline in this model of global health, that you have been discussing what is global health, isn't it? Anyway, in my view, it is nothing else than public health on a global level. It's the collaboration element, particularly, that is important. It is not so much about wealthy countries spending money in poorer countries. In my view, those days are over. Indonesia is not a poor country any longer. Malaysia is not a poor country any longer. China is not a poor country any longer. Used to be. So it's about collaboration between all countries. Perhaps there are some countries that are really poor. And there we need to go for traditional sort of overseas development sort of work. However, for the global health actors, my key element is collaboration in public health on a global level. Now, there are some people who are actually defining even global health and global health system as all the actors we were just discussing, as you can see here. So it's all organizations in the constellation of that are representing this global health infrastructure with the different actors that then constitute the global health system. We're going to go into governance in a couple of days, but you can start thinking already. You mentioned this multitude of different agencies. Is there such a thing like coordination and global health governance possible with all these different actors you were just describing? Now, I have a question here to everyone. Do we need to translate at some stage, or shall I stop here sometimes, or can we continue in English? The way that we're doing. I need just thumbs up to make sure that these sometimes complex elements are being captured by everyone. Are we okay continuing in English simply? For
Yes,
everyone?
please. Yes,
Okay,
please.
good. Perfect. In which case, I'd like to underline, and we come back to that, only with the example of rollback malaria. You know, that's a very big initiative globally in order to say we want to come back to rolling back malaria, to the efforts we had when we had the malaria eradication campaign, which was based essentially on the use of DDT to control Anopheles mosquitoes in the 50s and the 60s, where we had enormous success to control malaria, but it was, of course, impossible to continue because of the toxicity of DDT. So that's where rollback malaria kicks in. And you mentioned already, you know, that on one side, we've got global health actors that are multilateral, like WHO, bilateral, like USAID, for example. Then, of course, ministries, and you've got a multitude of NGOs. These are the 4 different levels that you can categorize according to the mandate. Multilateral is a club of countries. Bilateral is between 2 countries. Then, of course, you've got Ministry of Health. That's governmental in each country. And NGOs, they actually work as they pleases them. And then, of course, you've got the financing vehicle organizations like the Global Fund, for example, the philanthropic organizations, and you've got academia. They all have elements of contribution in a different way and with a different mandate. Now, you see here, even in malaria only, you're going to see a multitude of different actors, private sectors, different foundations, Global Fund, research academia, NGOs, OECD donor countries, malaria endemic countries, and WHO multilateral. That's exactly what we just discussed, isn't it? So you see, even if you go for a specific question, you're going to find that there's a multitude of different actors. We come to governance later. But you did really well, because what I'm trying to underline here first is there's an enormous amount of organizations working in global health altogether. And you can see here, even if you look only into the United Nations system with the different United Nations sort of organizations, so-called United Nations sister organizations, you're going to ask, oh, how can they actually be coordinated? In brief, I think they can't globally, but we come to that in governance in 2 days. What can be done is that on a country level, you have coordinating efforts for the organizations that you are working with, and perhaps on a regional level. But as I said, I just wanted to point out that we have. So on one side, let's start sort of with number 2. You have the intergovernmental organizations or multilateral organizations. They function like a club. It's member states who are signing up for a particular club. WHO is a club, after all, of member states, where countries are signing up and saying they want to collaborate on health in that specialized United Nations agency. There's also, for example, on gender issues, UN Women. And if you look up on the internet, on UN Women, there's only very few countries that signed up to that club, right? It's not as in all United Nations systems, all countries are always represented. It's the countries who decide to be in that particular organization being represented. So UNFPA is also dealing with gender issues, isn't it? Particularly with a focus on women's rights as well. And you know what? It's not everyone is represented. So what you need to think about 2 intergovernmental organizations. They are like a club. Then, of course, you have the sort of bilateral organizations, also here embedded in 2. And they are sort of between 2 countries. I had the pleasure to work on all levels in my life before going to academia, dropping to 6. But it really is interesting because the classical overseas development work is done by bilateral agencies as GIZ. We come to a historical overview in a second. 1 is, of course, states and national governments. So ministries of health are ministries. And then we have 3, like the non-governmental organization. I actually like to call the Red Cross, for example, on a local level, is a non-governmental organization. But as a matter of fact, globally, it's actually an intergovernmental organization. It functions like a club as well. It's member states who are signing up to the International Red Cross. So there's a mix of these different organizations as well. And you've got the private sector, you mentioned already, very important. I worked for most of my life in the context of neglected tropical diseases, and there the private sector, pharma industry with drugs donation for mass drug administration play a major role. You've got the philanthropic organizations like the Gates Foundation, and you've got academia and research institution, and not to forget civil society altogether. So that's a way how you can classify according to a mix of who gives you the mandate to operate and what's the mission, right? So these are different groups. You mentioned all of them earlier on in the different group works. Good. Any questions to that? For Thursday, you've got the task to think about how to coordinate all these organizations on a local level, on a national level, and globally, if there is a way. But we come to that on Thursday. Any questions? I think it's a very good job you did already in classifying and categorizing. Save questions for the next question round, so we have a bit of a discussion. So the other way how to look into it is historically, how they developed over time. And that's another way how to do it, right? And, you know, after all, don't forget, my view is that global health institutions are characterized by their working in public health and collaborative efforts globally. That's all what they're doing. That's, for me, global health and actors. And the first ones doing that are these Institute of Tropical Medicine, which you have in Indonesia as well, which actually started in the wealthy countries, unfortunately, with colonialism, because it was for the first time that, you know, sort of we had people moving around the planet rapidly, fairly rapidly, with boats, and where people were exposed to illnesses they didn't find in the country of their origin. And this is what really, with a disease focus rather than anything else, the institutes of tropical medicine, like, for example, London School of Hygiene, or our institute in Heidelberg actually did. We were also called Institute of Tropical Medicine. Because of the stigma of colonialism, a lot of the institutes like ours moved away from tropical medicine to global health nowadays. It's the same after all. They were the first ones working in international collaboration in health. By the way, interesting enough, there were many people who looked into preventive actions, so not only curative in those institutes, particularly those who were then working on diseases that are vector-borne, where you need to work on the vectors as well, like malaria, like dengue. And they started to discover that working on curative elements is not going to stop the disease. You need to work on the vectors, and that's biology and that's environmental issues. So that's also where the birth, really, of strong public health sort of thinking came up from those times when those institutes were sort of created. 1880, 1900 onwards. Next wave was the international agencies. In many ways, like WHO, in United Nations system, the Germans are the culprits in many ways, because, you know, you heard about the terrible history of Germany creating the two biggest wars we ever had on the planet. Unfortunately, the First and Second World War. And it was after the Second World War that United Nations system was created, predominantly with the aim that we're not going to have any further wars on the planet. But in United Nations system with that aim, there were also specialized agencies being created like WHO. So that's historically sort of in 1945 following, here for WHO 46 and 48, where we actually then had the United Nations organizations with specialized agencies. WHO is, of course, in many countries in the world, the predominant agency for international collaboration. As we all know, it's particularly good for standard setting. It's particularly good for guidelines. But you know what? If you go to the wealthy countries, who are setting their own standards and guidelines because they have money to do so, WHO doesn't play much of a role. In reality, WHO plays a role in the poorer countries on the planet where there's not enough technical capacity to develop standards and guidelines on evidence-based public health principles. But still, it's the organization in order to discuss globally between governments, particularly, on health issues. The next wave was really the bilateral agencies you mentioned, like GIZ, prior times called GTZ for technical collaboration, now international I collaboration. Z in German is collaboration, Zusammenarbeit. Horrible word, sorry for that. So that sort of started in the 50s of the last century. And that was something where we were looking really into overseas development and where we were going to say we wanted to make sure that the wealthier countries are supporting the poorer countries to develop economically, but also societal and, of course, in health. And GIZ is a typical example, but all the wealthy countries like JICA, for example, from Japan, or the Qatar Foundation today nowadays from Qatar, or USAID, used to be, as you all know, Coopération Française, even Coopération Española from Spain, were then spending money globally in different places. And they were actually had the aim to spend 0.7% of GDP of the wealthier countries globally. Never was reached globally. And I think we're reaching the end of bigger spending in overseas development, because don't forget, I was working, for example, in Brazil for many years for GIZ, or for 2 years, I should say. And the money was stopped because Brazil is a country with lots of resources nowadays, has a fabulous primary care system. There was no need to do any more spending in overseas development in the country. Right. So that's why we are seeing, I think, bit by bit with the development we are seeing globally, the end of overseas development spending in that sense, in my view. In the 60s onwards of the last century, we started to see a big population freedom movement. And that's where the non-governmental organizations were being sort of created. And there's zillions of them. Doctors Without Borders, I worked for Action Against Hunger, in prior times was for many years, and WHO forgot to mention as well prior to that. So those NGOs really, like Médecins Sans Frontières, they actually popped up in the 60s and 70s. And the basic idea was government is not going to listen to its own people. We need people movements, non-governmental organizations free of government in order to give operational aid to everyone. That's what the basic idea was historically. And as you know, NGOs, there's many, many, many different ones. Big ones, like Doctors Without Borders, they're almost like an international organization. Or there are smaller ones that are operating on a local level with a particular aim, isn't it? And here comes the last big wave, and we're still in it. And the last big wave is in the 80s and 90s, we thought, oh no, we need to mix governmental money, private money, and in order to find organizations that are going to work in different fields. This was when public-private partnerships popped up, and very often also public finance initiative, PFIs. And they are probably, correct me if I'm wrong, send me an email, please. The Global Polio Eradication Initiative was one of the first ones, already in the 1980s starting. I'm finishing in a second with my slides here. Well, you know, I collected this sort of slide here when I wanted to discuss global health actors and how many organizations are particularly public-private partnerships out there. I collected this quite some years ago. You could update that. There's many more. Some will have disappeared in the meantime. And what you're seeing is that particularly with PPPs and NGOs, we have, according to financing available, according to particular needs, a multitude of actors in global health. Historically, as I said already, first institutes of tropical medicine, they're all around, often called in a different way. Different United Nations organizations or multilateral organizations like WHO, but also UNFPA, UNESCO, UNICEF, no, all working in health, World Bank, etc. And then we've got the big bilateral organizations, NGOs, and a multitude of PPPs. That's how you can classify historically the different organizations. All helped by big financing sort of organizations like the Bill and Melinda Gates Foundation that actually finances an awful lot of these organizations you see here. Whew, that was a lot of slides, didn't you? You see already what I'm trying to say. See if you have any questions. You see already what I'm trying to say. It's good to know if you were able to discover with an organization that you don't know, how you can categorize the organization according to their mandate, international, bilateral, NGO, or perhaps governmental organization. It's good to know their funding background in order to then say what type of organization they're belonging to. And that helps you to classify the global health actors because, as I said already, there are so many of them. Any questions?
So Olaf, how this organization manage the money or the funding to operate, to give a mandate to operate to help the poor nation or poor countries?
Yeah, very good question. Let me start going back because there's a mix of everything towards that classification that we actually had. The international organizations like WHO, for example, They have a money collecting mechanism that is mandated in the United Nations via a mix of GDP per capita of any country and the size of the country in population. So there is then a compulsory fee that everybody needs to pay to WHO who belongs to that club. However, you will have seen that over the last, let's say, 30 years, additional money pops up in WHO, for example, and that is via Bill and Melinda Gates or any philanthropic organization or other countries who are giving extra allocation. So on one side, for the multilateral organizations, you've got the country-funded system, United Nations system, and additional money, private money. WHO is a poor organization relatively to other organizations globally. They don't really have an awful lot of money. And you will have seen that with the US withdrawing and Argentina both from WHO, money is going to be much less for WHO. If you look into the International Red Cross, also an international organization on that level, they collect mostly from countries and donations. If you're going to funding on the bilateral sort of organizations like GIZ and USAID in prior times, that's direct money from the US in prior times or German government for overseas development spending. And these are huge amounts of money normally, but as I said, I predict that this is going to dry up. If you're going into MSF, the next level, the NGOs, they collect money from donations mostly. And MSF is really successful in doing so. You see that more than 90% of the money MSF has, Doctors Without Borders, is actually donations from private people or philanthropic money. And then, of course, governmental organizations, they're getting money from the government, local government, clearly, taxes, etc. If you're then looking into the next level of organizations, who are the funding organizations? Where do they get the money from, isn't it? So you have research funding organizations, and they usually have a mix of national and regional money. So let's say, for example, if we're going to look into European Union financing an awful lot of health projects in research, but big money, they usually have their money from national governments and European Union allocated money in taxes. And if you look into the private and philanthropic funding organizations, then you'll see like Bill and Melinda Gates are purely operating out of the trust in the back with all that big money that the Gates Foundation actually has. And if you look into academia and the funding, there it's a constant struggle. Some countries have clear allocation via taxes, but mostly you need to apply for research funding to these funding organizations we just mentioned. So it's a mix, in other words, of international money, national money, and foundation money for each organization. And each organization will have a different mix where they're getting money from. Does that answer the question in the big picture?
Clear. It's pretty clear, Olaf. Thank you.
No.
Excuse me, Olaf, I want to ask one question.
Yes, please.
Okay, so in Indonesia, we have so many researchers to take data to make a research about stunting, maybe about anemic. So how far this data can change the policy or even the researcher doing advocacy to our government? How? Because we have read so many journals in Asia or even in Indonesia that maybe the government can change the policy based on the data taken by researcher, but how far the researcher can give some advice to our government? Thank you, Olaf.
Professor Kirana, you're now suddenly turning in an actor in global health, aren't you? Well done. So I would say, this is a different sort of session we need to discuss, and that is how to sort of work on evidence-based public health strategies. What we are suggesting there always, government should always, any health policy, any policy should be based on best available evidence. And what you can do as a researcher is, of course, trying to work on scientific evidence. but then also not only stopping at publication in a scientific journal, but also establishing at the very beginning, if you think there's something relevant, establishing contacts to your ministry, to those people who are setting health policy in order to support with your particular research the policy. We call it also knowledge translation. So there's this process of pull and push, meaning that the ministry should actually discuss with the universities what is the evidence they need to be sort of getting for their health policy. So we are targeting our research towards the needed questions. And then also, if you have questions that have been nicely addressed, that you're pushing that particular results towards your colleagues at the ministry in order to then say, see here. So there's a bit of not only having a scientific publication then, but the entire process of promoting the results of your research. Very difficult, but it is normally a question of we need to look into how to best present that. And there's something called evidence-based public health, and that gives a bit answers to that. But it's a bit of a different question than just describing the actors here. Saksikan, perhaps we need to set another question on evidence-based public health one day here in the course. But we all have difficulties with that, by the way, and also globally. Yeah. Good question. Any more questions?
Olaf,
Yeah.
I ask you, in Kebumen district in here, for tuberculosis treatment, we were assessed by USAID, but there is information that next year they will no longer be able to help and will be replaced by others. Does Olaf know what happened to USAID? Why did they
Yeah.
stop their assistance? Thank you.
Very good question. So it goes a little bit into what I said. I'm predicting that the money for overseas development from bilateral agencies like USAID is going to stop. Now, USAID as an agency was, because the US is very big in population and also lots of money, was the biggest of all overseas development spending agencies. The agency has been shut by the current government in the US. They stopped it from one day to another. So don't expect USAID to be existent, and don't expect that a lot of the projects you said, some will continue with the Ministry of Exterior of the US, but don't expect that these projects are going to continue.
Okay, Olaf, thank you.
Needs to be pushed back to national governments and responsibilities, not sadly enough.
Yes.
Right. Let's continue. Not much, but it's the same. I wanted to kind of, sort of apply now in very quick group work, 10 minutes again, but only 5 minutes feedback. Just go on the internet, pick any organization you like, perhaps USAID if you want to, and then you start looking if you find answers to the question of organizational structure and people, etc., funding, objectives, and activities. We're not going to have a feedback of what you found for each organization. My question is going to be, does it help if you want to assess, like the last question here, USAID, what's happening to USAID, if you go and check out the organization, check out the global health actor quickly, right? Is that okay as a take a picture again? I think you don't have the slide deck altogether. So go into your groups, pick any organization you want to. It doesn't matter which one, WHO, USAID, GIZ, etc. And then, oh, thanks for opening the rooms. It's very kind. Go to your rooms, take a picture first, discuss, go on the website of any of those organizations you want to check out, just one. And then try along those questions of organizational structure, funding, objectives, and what sort of activities will they do. Try to come up with an answer. Is it helpful to get a very quick overview of this particular global health actor going on their websites? So you understand with the categorization we gave you, applying what we just discussed. So you understand about the actor, if that's okay. Enjoy. See you soon. Okay, we're good here, I think. No, it's working. I think it's better. How good is the level of understanding of those who didn't come up with questions?
I think they're quite understand enough about the assignments. That's the reason why they participated quite active, I might say, because before sometimes in the class they barely ask the question. So I think we consider it a success and they understand quite clear about
Okay, perfect.
lots of
So
that.
it's more
That's really
yeah. I hope this is okay. What we thought is a good idea to work like that.
Mhm.
I do on Thursday we do the same sort of structure.
Okay, perfect.
Yeah, if
Perfect.
that's
Yeah.
okay.
Yeah, that's really
Because it's
good idea.
better than me doing slides and all of that. Because
Yeah. They got bored if you just you know the teacher explaining only from the PowerPoint but not practicing by themselves. Besides, our master students, they really are part of the actors for not the global health, maybe for the health itself, because some of them come from the health district office, and they are from the public health center. Some of them are doctors.
Well done.
We send you the background for each student, so
well done.
that's why they could explain you more.
No, but it's
Happen in the field.
How can we influence health policy? Oh God, I mean, oh God.
Like straight to the question. We didn't anticipate it, you.
If we ever find an answer to that one, it's exactly right. Okay, good. We get them back in about 5 minutes, and then have a bit until 30. We go for answers, and I have one more quick intervention about where my hope lies for the global health infrastructure, because I believe that ODA, the traditional overseas development, is going to dry up everywhere. And then we have a little bit of discussion what we learned, and we are finishing exactly on time on 1714.
Yeah, hopefully. But you still have, if you have 6 also, you can finish longer than that.
No. It's okay. We do exactly the timing that we discussed.
That would be fine.
I try to be on time always and not annoying everyone with more and more things to do. Okay.
Yeah. Okay, let's just wait for them to discuss.
2 more minutes. I just sent a message around. Right.
Think we can close the breakout room now?
I'm doing it as we speak.
Okay.
We can close them all together. We don't need them anymore.
Okay.
We keep them for
Mohon ditunggu Bapak Ibu. Olaf sepertinya terlempar. Oke.
I'm back again.
Yeah. We're afraid we lost you for a moment.
Yeah, we did indeed actually. And but that was me. Hello everyone. Nice that you're not all back as yet. I can see some people are still discussing. No, you know what happened? I decided to leave the room. Clicked wrongly. Right. Thanks for coming back. I know that you didn't have much of a chance. Zoom is not a very democratic system. The facilitator can decide on everything here. So, as I said, my question was that you go and have a look under those criteria for any organization of your choice. And don't necessarily feed back the details of what you looked at. Perhaps you just say, we looked into organization XYZ, and then tell us if you thought it was useful to look into a global health actor, if you have a question about an organization, to think in that way of organization funding, objectives, activities, perhaps any other criteria that you would like to mention. Who wants to feedback first?
Excuse me, sir, from group 3.
Perfect. Arumna? Laxmita? Who is it? I can't see. Please go ahead. Just talk.
Okay, from group 3, we select UNICEF.
Oh. Please go ahead.
UNICEF. UNICEF. Number 1, organizational structure, headquarters in New York with regional country and field offices worldwide. Led by an executive director appointed by the UN Secretary General, governed by an executive board representing UN member states, operates through thematic division, example, health, nutrition, child protection, and emergencies. And then the funding, UNICEF is entirely funded by voluntary contributions. Sources include government, private sector donors and foundation, individual and fundraising
campaign, UN partnerships, and intergovernmental organization. And objective, UNICEF mission is to promote the rights and well-being of children. We focus on health and nutrition, education, water and sanitation, hygiene, child protection, humanitarian response, and social policy and equity. And the last, activities. UNICEF work through vaccination programs and immunization campaign, and then maternal and child health services, nutrition interventions, supply distribution, example vaccine, medicine, emergency supplies, and then advocacy and policy engagement, emergency response, and data collection, such as MIKES, multiple indicator cluster surveys. Okay, I think enough
Right.
from the group 3.
Perfect. Thanks for that. I was, as I said, not necessary to look into all the criteria and report here. The question was it useful to look into an organization like that under those criteria? Perhaps for the next groups to answer. Well done. Group 3. As I said, don't go into details, more into overlooking with a bird's view. Is it useful to look into an organization in this context? Next group.
Group
Group
2,
4.
Olaf. Okay, group 4. Go ahead, group 4.
Thank you, Mbak Saksikan, izin. Thank you, Olaf. So we describe about MSF or Medicine Sans Frontiers or Doctors Without Borders. So the organizational structure is International Council, 5 operational centers, and 25 countries office, field teams, and the fundings is from 90% from private donation, minimal government funding. The objective is provide emergency medical care, uphold neutrality, bear witness, advocate for access to medicine, and the activities is emergency care, epidemic response, surgery, maternal health, nutrition, mental health, refugee care, and advocacy. Thank you.
Thanks for that. Again, for the next group, don't necessarily just mention the organization and then tell us if it's useful to look into an organization under those very easy criteria and what are we learning with that, so to speak. No? Next group.
Group 2, Olaf.
Okay. Sesi first.
Okay, sorry. Thank you. We will talk about the GIZ, or the Dutch Gezelschaft International. It's a German development agency and provides service and fields in international development cooperation and international education work. The mostly programs is about the global health program. It's about the highly active in a global health, including a health system strengthening, digital health solution, universal health coverage, and health financing reforms, also surveillance and epidemiology, maternal and child health, prevention of HIV, TB, and malaria, and also support the Global Fund implementation. The most funding from the German government, it's about 70%. And also the activities more in focuses and in sustainable development, and also economic, peace and security, health education, and also the climate change.
Perfect. Good. So we had now, well done. So we had an NGO, we had an international organization, and we had a bilateral. Let's see what the other groups are going to tell us. Who wants to go next? And also just tell us the organization and what do you think? Was it useful to look into that organization that way under those criteria?
Okay. Maybe group 6.
Okay, fine, Mbak Razin. Me first or you? Okay, Olaf.
Trying to fight each other, huh?
Yes.
Ya, cukup Mas Bu Aurin ya. Silakan.
Group 5, we choose Global Fund. Okay. The funding, it raises money from 3 years replenishment cycle from donor government as the primary source, and the private sector, and also foundation. And the objective to end the epidemic of AIDS, tuberculosis, and malaria, and also to build resilient health system. And the founders from this global fund is Bill Gates, Melinda Gates, like that. And this organizational structure, it's a multi-layer partnership with a board of directors, providing governance and strategic guidance, supported by a secretariat that manages operation from Geneva headquarters. Okay, thank you, Olaf. It's
Perfect.
global fund.
Okay. Well done. So we have a finance vehicle. Well done. And the next one
Okay.
before last. Person, yeah.
Yeah, right. I'm from 6th group. So I will talk about PMI or Palang Merah Indonesia. Maybe you know Red Cross, but it's in national level. So PM for organizational structure-nya, PMI is a national humanitarian organization in Indonesia. It has a central leadership at the national level and branches at the provincial and district level. So they can respond quickly to community needs. And then the funding, PMI or Red Cross Indonesia receive funding from donation from the public, and then partnership with government and support from International Red Cross maybe. And then PMI, they do not aim to make profit because they are a humanitarian organization. And then the main objective are to provide humanitarian assistance, and then to help during disasters, and then to support to donation service, and then to help improve community health and preparedness. And then the activities, PMI activities include emergency response during disasters, and then running blood banks, and then providing first aid training, and then supporting health promotion in communities. So why we choose PMI useful as a global health actor? Because it reach local communities quickly, and then it provides essential health services, especially blood supply, and then it supports the government in emergency. Maybe that's all that I can say
Perfect.
to you. Okay, thank you, Olaf.
Very comprehensive report as well. And the last group.
I am the last group, Olaf.
Perfect.
Okay. Our group is different. We choose FAO. FAO as structure and decentralized organizational system. FAO has headquarters in Rome, support regional officer, regional office, country office, and the founding FAO is funded through two major sources, from assessed contribution, and second from voluntary contribution. And the objective of FAO to achieve food security for all and ensure that people have regional access to sufficient high quality food to lead healthy lives.
Perfect.
And the
Well done
activities is technical assistance to governments in agriculture, fisheries, and forestry, monitoring global food security, capacity building for farmers, emergency response during food crisis, and policy support. Thank you.
Thank you very much for all the groups. As a matter of fact, as you will have realized, is I gave you the task to look into a global health actor in order to see that it's very easy, and that was actually what we wanted as a feedback, to quickly get an overview of an organization if you're going to look under those criteria. And I think you did really well in showing that. I also mentioned, since we're almost out of time right now, that I think the global health infrastructure is going to change. And it is going to change because the overseas development agencies traditionally, like USAID and GIZ, are going to have less money available for direct spending, and it'll be more about cooperation between countries. That's why I wanted to give an overview very quickly only that I think we are going to see far more, that the G20, Indonesia forms part of it, I think, is going to look far more into questions of health than we ever did before. At the moment, they're looking into antimicrobial resistance, public health emergencies, and universal health coverage as topics. Traditionally, the G7 looked into those as well, but I think G20 is far more powerful nowadays, I think, replacing a lot of the overseas development spending. Never forget, in G20, we have most of those people above the age of 60. So it's, sort of anything related to NCDs in the big context of epidemiological transition is really predominantly important for the G20 countries altogether. And that's also why I think, sort of that if we're going to look into saving the world, climate change, I also think the G20 are the ones where we're going to see as a global health actor in international sort of money being spent. We're going to find more coming out of G20 than anyone else, I suspect. Only to finish, of course, most pharmaceutical companies are actually in G20, including Indonesia. And that's where my hope is that we're going to see far more roles on global health coming out of the G20. Just as a statement, we're going to reflect about all of that on Thursday. Now, there's another element. You've seen climate change, of course, and the COP30 now in Beliau. I was not in Beliau. I was only a couple of thousand kilometers further south in a different workshop. I don't need to underline the dangers of climate change. You're getting the slide deck anyway. We're going to send it around, where there's actually quite frightening sort of levels of changes that we're seeing depending on climate change sort of threats and different levels of temperature increase. You can read up on it later on if you wish, where it happens if we're going between 1 and 1.5 or 2.3 or 3 to 4 grade temperatures higher, and 4 to 5 where it's going to be catastrophic, really. I'm only mentioning that because there is, of course, also a health aspect in climate change. And that's why I also think that COP30, it's G20 and COP30, I believe, who in the future need to be bigger players of global health actors compared to how they look like. So far, so good. I usually do a session of what did we learn today? Our time is up. We do that on Thursday. Don't forget, I tried to classify global health actors with you according to their different objectives and also their mandate, meaning governmental organizations, non-governmental organizations, etc., funding mechanism, operational, or perhaps academic institution. And I tried to explain how they actually developed over time. I also tried to highlight that if you want to know about a global health actor, then it's very easy. You're going to look up on the website. It's very open nowadays. You find everything according to different structures. But I'm going to ask you first, next Thursday, what did we learn about global health actors? What did you learn? So come up with an idea. We do that as a first exercise when we meet again on Thursday, if that's okay. And then we're going to ask, how can you actually govern? How can you coordinate all those global health actors, if you can coordinate those? Perhaps we get a little bit of your experiences on a district level or on a national level or even international. Is that okay? So no questions now. We postpone everything until Thursday. We start first with what was your lesson learned of today? as a brainstorming, and then we're going to look into governance. Is that okay for everyone?
Okay, Olaf.
Just to
Okay.
Just to finalize, and you can get home, or if you're not home already.
Okay.
See you on Thursday. Sorry, we are a couple of minutes over time. I try to be on time always.
That's okay, Olaf.
I'll see you on Thursday.
Yeah, we'll see
Okay.
you again on Thursday. Thank you very much.
Okay. It's a pleasure.
Thank you.
Bye-bye.
Yeah.
Thank you.
Bye. Have a good
Bye,
rest. Have a
Olaf.
good rest.
Thank you, sir.
Thank you very
Thank
much.
you.
Jadi seperti itu Bapak Ibu.
Okay.
Sila. Did you left? Yeah, he left immediately. Terima kasih partisipasi aktifnya. Ditunggu partisipasi aktifnya lagi di hari Kamis. Mudah-mudahan semua di hari Kamis nanti semuanya bisa mulai berbicara lagi. Nggak susah kok orangnya. Iya, deg-degan aja ya. Ada paniknya dikit ya. Apalagi kalau ketemu langsung. Masya Allahu Akbar ya. Baik, terima kasih Bapak Ibu atas partisipasi aktifnya. Kita insya Allah ketemu lagi di hari Kamis. Insya Allah di jam yang sama. Semoga bisa bergabung online. Dan saya harap juga teman-teman bisa on cam ya yang besok supaya bisa terlihat semua dan bisa dilaporkan ke Prof. Dwi, Prof. Budi, dan Prof. Siwi.
Thank you.
Terima kasih banyak Bapak Ibu. Selamat beristirahat. Oh salah, selamat melanjutkan aktivitas sebelum nanti kuliah lagi jam 6:30 dengan Prof. Budi. Terima kasih. Saya tutup. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you.
Waalaikumsalam warahmatullahi wabarakatuh.
Absennya enggak ya?
Baru ingat
Absen ya? Nanti saya kontak Prof. Dwi. Kami tidak disampaikan soal absen.
Tenang, masuk semua. Tenang,
Masuk
masuk semua.
semua, masuk semua.
Masuk semua.